Hello, my name is Dr. Deepal Dalal, and I'm at the Desert Foot Conference in Phoenix, Arizona. I'm here with Dr. Cyaandi Dove, who just gave an excellent presentation on venous leg ulcers and different modalities to treat it. Thank you so much for your lecture, and thank you for sitting with us to interview. My first question for Dr. Dove is actually, how do you decide whether to use a hyperbaric chamber for your patients or whether to use topical therapy with oxygen?
Really, I leave it up to the patient because I strongly believe that both modalities are effective, but I can tell you that most patients strongly prefer something that they can do in their home, that is much cheaper, and it's going to be a lot less of a burden on their day-to-day lifestyle. So most patients, when given the option, they will choose topical wound oxygen therapy as opposed to hyperbaric.
Okay. How do they use it? How do they apply it? How frequent do they have to use the oxygen therapy?
So the typical protocol for topical wound oxygen therapy is usually around 5 days a week. They can use it once or twice a day, but a 90-minute treatment cycle for the topical wound oxygen therapy. It's fairly simple to put on, but when therapy is initiated, our nurse will come to the home and instruct them, and then the patient themselves or a family member can apply it.
Okay. Is it pretty easy for them to do it themselves, or would they need assistance from a family member or a nurse, like you said?
It really depends on the patient's mobility, if they're able to bend down, if they need assistance or not, their age. So I think a lot of the patients, if they're fairly mobile, they can do it themselves.
Have you seen any complications that have come out with either hyperbaric chamber or with topical oxygen therapy?
You know, in all my years of practice, I've never seen a complication with hyperbaric oxygen. The potential's there, but the protocols are followed so carefully. I personally haven't seen a complication. I know that's a possibility, and I have never seen a complication with topical wound oxygen therapy.
That's great. What point in a patient's care do you decide to apply the oxygen therapy? After how many months have they had a wound, or are there certain guidelines that you use to decide when to use it?
So really, if you're looking at the literature, there's a landmark paper by Dr. Peter Sheehan that shows that if after 4 weeks the wounds are not healing, that's going to be considered a chronic wound. That wound is not on a trajectory to healing. So you should start looking for more advanced modalities. So I would say if you have a wound, personally in my office, if it's going on for 6 weeks, 7 weeks, you should consider that as a frontline adjunctive treatment for a chronic wound.
Okay. And then how do you talk to your patients about using the oxygen therapy? You know, what is it that you tell them to guide them in kind of understanding what it's all about?
I reiterate the importance of the benefit that they're going to have, that hopefully they'll heal faster, have less recurrence, and less chance of an infection, because this also works on infected wounds as well. And I stress compliance to them so that they'll be more engaged in using it. Most patients, psychologically, they like the idea of oxygen. Patients with wounds that are not chronic, they're acute wounds, they will even ask, hey, I heard about this oxygen thing. Do you think this could work for my wound? So telling patients that they need oxygen therapy, it definitely is not a hard sell. Patients really like the idea of having something that's natural to treat their wound with minimal complication.
Excellent. One of the things you mentioned is that you have used it in infected wounds as well. Have you used it in patients with osteomyelitis?
I have not yet, but I don't think that it would be counterindicated.
It would or would not, sir?
Would not.
Okay, would not. Okay.
No.
So that may be the next step as well to trying that out in an osteomyelitic patient. Okay.
There's just quite a bit of shortage of research, so it would be great if somebody could, delve into that from a research perspective to gather some prospective patients with osteomyelitis and see what the results are, because we don't know.
Yeah, definitely. Excellent. Well, thank you so much for your time. I appreciate it. Again, this is Dr. Cyaandi Dove, and I am Deepal Dalal from Desert Foot Conference in Phoenix, Arizona. Please stay tuned for more segments to come.